Today we are here for the National Livestock e-vaccination program. This is our program by the government, national government, the county government, and also NAVCDP, which is a project in the county. Just to say briefly, in NAVCDP, we have value chains that have been prioritized, and dairy and also red meat are among the key value chains that have been prioritized by most of the counties under NAVCDP. And I want to say that our objective as NAVCDP is to increase market participation and value addition of the targeted value chains in the target community. And one of the challenges that we have had, especially with the dairy and red meat, is the issue on disease control. So the government, under the animal health and genetic delivery model, came up with this program so that we can address the challenges that are there on issues of animal health, in order to access the market, improve animal health, and also improve the incomes of the livestock farmers. Thank you.
So what are we doing here today?
So today what we have been doing under this program, we have farmers bringing in their animals for vaccination against foot and mouth disease. Because the challenges that farmers have, among other diseases, foot and mouth disease is one of the critical diseases affecting livestock farmers. And also in terms of cost, it also makes the cost of livestock production high. So this program targets vaccination against foot and mouth disease. The government subsidizes the cost of the vaccination. Farmers are supposed to pay 50 shillings, and the government, through the county government and also NAVCDP, pays 110 shillings for the farmer. So in total, the cost of vaccination is 160, but the farmer only pays 50 shillings for the vaccination. But we also have the muzzle. We are using the muzzle technology, what you saw there. That is for identification of the farmers. Today, this is just a regular vaccination exercise, but foot and mouth disease occurs in this county and even the neighboring counties frequently. But one of the roles of vaccination is so that we can be able to, is more like protective, so that the animals are covered against foot and mouth disease. Because we have had vaccinations previously, but we have been having they're called what? Sporadic vaccinations when we have outbreaks. But for this one, we are doing the vaccination across all the 30 wards in the county.
So far, we have managed in Bondo to vaccinate over 5,000 animals. But our expectation is supposed to be 10,000. So we are still expecting to do much in terms of vaccination so that we have a good coverage of foot and mouth disease vaccination. Just like us human beings, we normally use the term when we want to know the type of the person. This new technology was developed and it helps in the identification of an animal. So because each animal, once it has been scanned and all the details are taken, because the farmer who is the owner, his details are also taken. So if it gets lost, and we found in Western Kenya, through scanning, the information will be got and we can really trace where the animal came from. That is the new technology that has come so that it helps us to eradicate the theft and also to help in identification of even the animal that has been vaccinated. Let's say sometimes somebody just heard that we are doing vaccination, he brings the animal back. When it is scanned, the information you will be given the information that already the animal has been covered. So it also helps us in that.
The main reason is try to control or eliminate foot and mouth disease in this country. Not only our county, but this vaccination is happening all over Kenya. We hope if we can vaccinate 70% of the animals, we will be able to contain this disease. And foot and mouth is endemic in Siaya. We always have outbreak in Rarieda and Alego Usonga. And that normally results in imposing quarantine, and we cannot trade. Hence, farmers and both traders are losing on their economic livelihood. So I humbly request all our farmers to avail the animals. It is only 50 shillings. If we can vaccinate 70% of the animals in Siaya, our numbers are at 150,000, and we target to vaccinate 115,000 to achieve a target of 70%. So far we've vaccinated 30,000 and we are continuing aggressively. Our officers are ready and are always willing to work even over the weekend to ensure we achieve our targets.
First of all, I say thank you for the Siaya County for assisting us with the vaccination. And again, we are requesting one thing, information. Yeah. We lack information. That is why you see the animals are not many here. We just heard this morning that the vaccination is going on. So next time, please, it is better for us to get information maybe 1 week earlier so we can get prepared.